Thank you, Daniel. Greetings, one and all. So I'm Dr. Jayapriya Jayakumar, but before I get into the session, I really want to congratulate Fresh Dental Shadowing for creating this platform of continuous learning, especially during these unprecedented times. I know in my time, I could not shadow someone from abroad. And also as a dental student, I had no idea what forensic dentistry is, what forensic odontology is. So this is going to be a great opportunity for you to learn about forensic dentistry, but at the same time, an opportunity for me to spread awareness on the subject as well. So that's me. That's Dr. Jayapriya Jayakumar. I did my BDS in India. I have an MSc in forensic dentistry and also a diploma in archaeology and anthropology. So today we're going to be discussing about my professional background, how I decided and how I became a forensic dentist, why I chose forensic odontology and how I chose my university abroad, advice for future dentists, and then we're going to dive into the introduction in forensic odontology. So the definition, why we need forensic odontology. We're going to be looking at some of the famous cases from all over the world, and we're going to look into a typical day as a forensic odontologist. So I'm going to be discussing about some basic steps in dental autopsy. And then we're going to be going to the research aspect of today's session, which is the role of dental anomalies in human identification. So I'm from India, but I was born and raised in Muscat in Dubai. So all of my schooling was done in Muscat in Dubai. My dental school, so that's my BDS in A.B. Shetty Memorial Institute of Dental Sciences. It's a uni in South India. I also did my internship, my residency there as well. And during the residency, I had a 3-month rural studentship as well in South India. I also did a studentship in France. So it was with Paul Sabatier University in Toulouse. It's a city in southern France. But this was such a eye-opening experience for me. And that is how I decided I want to do my master's abroad and not in India. And as you would know, I did my specialization in forensic odontology in University of Dundee, Scotland. I also had a scholarship called the Global Excellence Scholarship to back me up. I also have a diploma in forensic archaeology and anthropology in Durham University, England. Currently, I'm also a prospective PhD candidate in the same university in Scotland, UK. How I chose forensic odontology. So I chose forensic odontology purely out of interest. So, and who doesn't like Sherlock Holmes, and who isn't interested in a docu-series on a crime documentary on a serial killer as well? So it was basically only dependent on my interest in research and forensics within dentistry. How I chose forensic odontology. So when I was a dental student, I had no idea what forensic odontology was. So I had to do extensive research on Google to find out what university to go to, what is a forensic odontologist's life like, and which university I'm going to choose. So after my research, I realized at the time in 2019 that all around the world, only 3 countries or 3 universities offered a master's in forensic odontology. The countries were Belgium, Australia, and the UK. In the Belgium, you had to learn the language before you took the master's, which was something that I wasn't keen on. So then it was between Australia and UK. But between Australia and UK, I observed that there was a lot of academic and non-academic backup for international students in the UK. And that is one of the reasons why I chose UK over Australia. Now, even within the UK, why University of Dundee? So when I joined, so that was 2019, University of Dundee, the dental school of University of Dundee was ranked #1 in the UK. And similarly, the forensic school was also the top 10 graduate schools in the UK as well. And I still think both the dental school and the forensic school, they're both in top 5 when it came to universities in the UK. And I really thought this was important for my CV as well, because your dental school or your school rankings also play an important part when it comes to the hiring process. Also for the fact that they had a very unique forensic odontology master's course, especially because they sort of had that foundation before you jumped into forensic odontology itself. So we had forensic science, we had forensic medicine modules, we had forensic anthropology, archaeology, even forensic law. So we even had like basics in criminal law because you're going to be working as an expert witness in court as well. So it was such a unique course. It covered a lot of basic topics before you jumped into forensic odontology itself, but also for the fact that the staff were really supportive. We had a lot of hands-on experience in autopsies, both dental and medical, but also for the fact that the course was very feedback-based. So it was tailor-cut to what the students' needs were. So it was such a really good experience doing forensic odontology here as well. Also for the fact that the university was awarded University of the Year for student experience. So it had so many societies. There was a lot of mental health support system for students and staff. There were also a lot of events, and this is before the COVID-19 pandemic, of course. So even the student societies and the student support was absolutely wonderful in Dundee as well. And also for the fact that the city itself, it's a very beautiful, very calm city compared to Edinburgh or Glasgow. It's very fast paced, but also as an international student or as a person of color, I needed to know that I would be welcome in the society. And from my last 3 years of experience, I can say that it's a community of very warm and welcoming people. So these were the few things I looked into as an international student before I came into the UK and before I chose University of Dundee to do my master's in. Now, a little advice for future dentists, and I'm going to divide this into the ones who are interested in forensic odontology and the ones who are not. So for the ones who are interested in forensic odontology, I'm definitely going to say, if you're really interested or if you're really passionate about the subject, just go for it. I know it's a research subject and it's got a clinical aspect to it, but it's still way more research based. So it's definitely got its own struggles. But if you're something passionate, if it's something that you're passionate about, I would advise definitely go for it. But when I say this, I should also say that research has its own struggles. I know dentistry needs a lot more patience, a lot more discipline as a subject itself. But when you become a clinical academician, when you go into research, you need double the patience with your results, double the discipline. There's a lot of academic writing, reading, literature going into it. You're definitely going to face a lot of issues related to funding for your research, even finding a full-time job. But the most rewarding fact is that you will be shaping the future of dentistry with your results. It's other dentists and other dental students are going to look up to you and they're going to go through your work and they're going to learn your work. And you're definitely leaving a mark in dental history, which is quite rewarding. And even this is a personal thing. So just because it's rewarding for me, shouldn't be the same thing for another person. But if you're really passionate about it, I would definitely say go for it. Reach out to other forensic dentists before you jump into forensic odontology. The difference between shadowing a dentist or virtually shadowing a dentist and a forensic odontologist is that there are so many dentists with Instagram accounts and TikTok reels and stuff like that where they share their knowledge and where they share their experience. It's quite different when you become a forensic odontologist because you can't really share your cases, your experience with an audience on a social media platform. The reason why, because we're dealing with death and decomposition and assault and things that are very sensitive. So you can't really share these cases to an audience that you have no control in. Also for the fact that your cases or when you share your own experience, because it contains so many sensitive material, sensitive topics, it can trigger a response in someone as well. But irrespective of the fact that they have a following on Instagram or TikTok, if you know a forensic odontologist, reach out to them because I'm sure even if they don't have a huge following or they're not doing TikTok dances on Instagram, they're still ready to give you any form of guidance, any form of information as much as they can. Another very less talked about part when it comes to forensic odontology is that you're dealing with death and decay. I know a lot of students who jump into taking forensic odontology and halfway through they drop out because it takes a toll on them. And not to scare dental students, but it does, because you're surrounded by a lot of things that are considered negative all the time for your work. So this is something that is very less talked about, and there needs to be a lot of awareness into what forensic odontology entails before you jump into taking forensic odontology. And this is also probably because as dental students, we don't have any previous experience with dealing with death compared to medical students, because they have forensic medicine and they deal with death and stuff, something of that sort. But because we don't have any previous experience, the sudden jump from just dealing with live patients to forensic stuff is going to be a huge transition, which somebody should be mentally prepared for. And mental health wise as well, there is a stereotype, or there is a belief that forensic practitioners have issues with substance abuse because they fail to disconnect themselves from work and their personal lives. And although there have been studies that actually prove that this is true, it is definitely possible for you to disconnect your work life and your personal life. But if you really need that support, that mental health support, you should definitely ask for it, because dealing with death is not an easy thing. And especially when you're surrounded by it through your work life, it's definitely going to have some sort of effect on your mental health. And it's always okay to ask for help. So that is, again, another aspect of forensic odontology that is not talked about. Now, for the ones who are not interested in forensic odontology and they're just curious about the subject, there are so many ways you can support your fellow forensic odontologists. And I'm going to be discussing about this in the further slides and more in detail in the research part of my discussion today. And before we go into forensic odontology in detail, I just want to say that the presentation is definitely going to contain triggering sensitive material. I'm going to be discussing about death, decomposition, human remains, sexual violence, rape, sexual assault, abuse. If you feel triggered, please feel free to take a break and then come back. I've tried my best not to put any gruesome images. All images in the presentation are only for academic purposes, and I'm not going to go into huge details into these as well, but I need to touch upon these subjects to give you an idea about forensic odontology. And I also have a request: please don't take any screenshots of images and share it on social media, because, as I said, it could definitely cause a trigger response in one of your followers or someone you love. It can also cause your account to be suspended because you wouldn't be complying with social media regulations. Now, going to forensic odontology itself. So first, we're going to be looking into the definition of forensic odontology by Federation Dentaire International. It is that branch of dentistry which deals with the interest of justice, deals with the proper handling and examination of dental evidence, with the proper evaluation and presentation of dental findings. Now, why do we need forensic odontology? So, identifying an individual is basically determining their individuality. And we know for a fact that primary identifiers through decades have been DNA and fingerprints. Now, the issue with DNA is in identical twins who share the same DNA pattern, fingerprints definitely hold an upper hand. But in some cases, you don't tend to get fingerprints. So in cases of major fires or extensive decay or decomposition or even trauma, you might not get fingerprints. And this is where teeth comes into a picture. So teeth not only provides individuality to someone, but is also durable and highly resistant to damage. So this is one of the reasons why it is one of the most easiest, reliable, and economical method of identification. Why? Because DNA and fingerprints, although they're primary identifiers, it's a very time-consuming process. It's a very complex process as well. It's also expensive because you have these extensive databases and you need complex softwares to actually identify someone using DNA and fingerprints. But at the same time, if you're identifying someone with teeth, you just need their dental record and themselves. So this is one of the reasons why it is the easiest, reliable, and most economical method of identification. Now, what does a forensic odontologist do? So the first bit is human identification, which is the major portion of our work, and it's also the major portion of today's topic. Another thing that we do is age estimation. So age estimation is a very complex, but a very interesting and important part of forensic odontology. And you do age estimation on children, but also adults and adolescents. There are various methods of doing age estimation. You have a visual method, radiographic method, biochemical method as well. It's normally used for legal purposes. So if you want to estimate the age of an accused person or a victim when it comes to sexual assault, to know if that person was a minor or not, you use age estimation. Also for the fact that to understand the refugee status of a person so that we understand what benefits they get, at least in the UK. So to understand refugee status as well, we use age estimation. Another important part of forensic odontology is bite marks. Now, bite marks is a very interesting part of forensic odontology, but it's also a very sensitive topic. A lot of forensic odontologists opt out of doing bite marks because of the risk factor involved with the subject. So there have been so many wrong convictions in the past, especially in the US, for several reasons, which is another lecture of its own. But this has quite tarnished the image of forensic odontology when it comes to bite marks. But now with a lot of new softwares and definitely technological advancement, bite marks has also become better. So yes, it's definitely a part of forensic odontology as well. Another aspect of forensic odontology is disaster victim identification, or DVI. Now, this is a very physically strenuous part of forensic odontology. It depends on how bad a disaster is and where it is located, or also for the fact that how many victims you have to identify. So you'll be located in anywhere in the world where there's a disaster, and you might have to identify one victim after the other for days together, maybe without a break even. It can also take a toll on your mental health because you're surrounded by death and disaster through the day. So it's definitely a strenuous part of being a forensic odontologist, but also a very important part, DVI, or disaster victim management. Another part is identification of medical or dental fraudulence. So this is more of a corporate legal use. So you basically identify if a treatment was required, if it was necessary for a patient, or if it was done for financial or personal benefits for the dentist. But there's also the research and teaching part of forensic odontology as well. And also you can work as expert witness in courts. Here's some of the famous cases in forensic odontology. So the first ever documented case of forensic odontology happened 2,000 years ago in the Roman Empire. So there was a Roman Emperor Claudius. His second wife, Agrippina, ordered her soldiers to kill his first wife, Lolia Paulina. After severing Lolia Paulina's head, Agrippina identified Paulina using her dental alignment and certain distinctive characteristics of her dentition. And this is the first recorded use of dental identification that we know of. Another interesting case of forensic odontology is of Adolf Hitler. So, as you would know, Adolf Hitler and his wife committed suicide after the Second World War. And although there were remains of Hitler, so there's a partial skull fragments that were received in Russia, the Russian autopsies were quite inconclusive. But 23 years later, Hitler's dentist identified these fragments as of Hitler's using his 9-unit dental bridge and confirmed his identity. So this is also one of the very interesting cases that used dental information for identification. Another very, very famous case is of Theodore Bundy, or Ted Bundy. As you would know, he was an American serial killer who was responsible for the rape and murder of more than 30 young women in the US. But one of his victims, Lisa Levy, got bitten by the attacker and she got to get. And after a police investigation, Ted Bundy was forced to submit a dental examination, as you can see in the picture. And it was confirmed that the bite marks that were found on Lisa Levy matched his impressions. This was the first recorded time in Florida's history where the case fully depended on bite marks as its primary evidence. And to know about this further, there is a documentary on Netflix called Conversations with the Killer, the Ted Bundy tapes. That there is definitely the movie played by Zac Efron, which is called Extremely Wicked, Shockingly Evil and Wild, which touches on the topic as well. From a very DVI, or a disaster management perspective, two of the major disasters that used forensic ontology were the World Trade Center disaster and tsunami disasters. So in 2001, during the World Trade Center disaster, at least 501 victims were identified using dental comparison. Similarly, during the tsunami in Australia, there was a huge number, almost 80% of victims were identified using dental comparison. But also in Thailand, 7 months after the disaster, 70% of the victims were also identified using dental information. So this is forensic ontology from a DPI perspective. So these are some of the famous, very famous cases that used forensic ontology for identification. Now we're going to be looking at basic steps in an autopsy. So this is what a typical day looks like. You'll be called in for an autopsy, and these are some of the steps that you would cover while doing a dental autopsy. So of course, there's the initial prep. So you use your PPE, you prep as if you're going for a surgery. So you double glove yourselves, you double mask yourself, because you never know the kind of body that you're going to be doing an autopsy on. So you're fully covered so that there's no transmission of infectious diseases or any sort of microbes. And it's preferred that two dentists do the dental autopsy, and you assign between yourselves, so as the dirty dentist and as the clean dentist. So the dirty dentist is going to be the one who's going to do the dental autopsy. The clean dentist is the one who's going to do the charting as dictated by the clean dentist. And you have two forms when it comes to dental comparison. So there is an AM form, which is the ante-mortem form, and the PM form, which is the post-mortem form. The ante-mortem form is the yellow form, as you can see on the screen, and the PM form is the pink form. The pink form will be the one that you're going to be using during the autopsy. So while you're in the mortuary going to start your autopsy, the clean dentist is going to have the pink form, which is the PM form. Then it's the dental prep, or the oral prep. So this is basically gaining access to the oral cavity. Now, because there is going to be rigor mortis, and again, as I said, you wouldn't know how the body is going to be like, you need to pry open the mouth so that you get that access to do a dental autopsy. So usually you can do it with your hands, and you pry open the mouth till you get proper access, proper visibility to do a dental autopsy. And that's going to be your prep before you do your dental autopsy. Now, there are some cases where there is a lot of rigor mortis where you can't pry open the mouth. And this is only when you do an incision. And there are several studies that talk about different kinds of incision, but you need to make sure that your incision is as less invasive as possible. So the incision very commonly done is from the angle of the mouth to the tragus of the ear on either side. You open the flaps up, you do the dental autopsy, and you stitch it back up. One thing that needs to be observed is that this needs to be your last measure when it comes to doing a dental autopsy. And of course, once you get access to the oral cavity, then it's your dental prep, as I said before, because you don't know where the body comes from. It can be dug out of a marsh. It could be from the river, from the sea. there could be dirt, there could be maggots, there could be worms crawling out of the mouth. So because you don't know what the condition is of the body, you definitely need to clean the dental area so that you have proper visibility. And you can do it using tweezers, gauze, cotton even, but gauze is more preferred. Once you have proper visibility to the dental area, you start charting. So that's your PM recording, post-mortem recording. You chart exactly how you would chart with the patient. So you start with the first quadrant to the fourth quadrant, and you do your PM charting. Once you do your charting, there are radiographs. So most of the mortuaries or even forensic odontologists, they have a portable X-ray machine, as you can see in the picture. Most commonly taken radiographs are periapicals and bite wings. Once you take the radiographs, you take photographs. Now, the thing with photographs is sometimes you have to identify a whole body, and sometimes they're just fragments. So you might get a mandible, you might get a skull fragment. Sometimes you just have a few teeth to work on. This is when you use something called as an ABFO scale, as you can see in the picture below. It's called the American Board of Forensic Odontology scale. And you use the scale to take the picture so that later when you work on the fragment, you have the measurements of how big or small the fragment is. But if it's a body that you're going to be identifying, then you take pictures exactly how you would take pictures for a live patient. So you take an anterior picture, right buccal, left buccal, maxillary occlusal, and mandibular occlusal. And this is your post-mortem recording. The ante-mortem data collection is not something that you would do. You can do as well, but it's something that the police usually does. So AM data or ante-mortem data is anything that can give you information on someone's dental cavity. So it can be dental records, x-rays, photos, charts, even appliances, study models, and casts. So anything that gives you info on someone's dental cavity, dental information is AM data. And as I said, it's mostly done by the police. And this is one of the reasons why this session has been held for the Scottish police as well, because they would know what can be collected as AM data. Now, once you have your AM and PM data, and once you receive your AM records, you transfer it into the AM form, as I discussed before, the yellow form. And once your forms are complete, you start doing a comparative analysis. Now, you always do the PM first and then the AM to reduce bias, because you might have a subconscious tendency to sort of, once you see the AM data, you sort of try and match your findings while doing your PM. And to reduce this sort of subconscious bias, you do the PM first and then you do the AM. After your comparative analysis, you're going to be coming to 4 of the set conclusions. So positive identification is when you say, okay, this body is Mr. X. Possible identification is this might be Mr. X, but there are inexplainable inconsistencies that are with data can be explained. Insufficient evidence is when you don't have enough AM data to do that comparative analysis to come to a conclusion. Exclusion is when you say, okay, this is not Mr. X. And these are the 4 conclusions that you would come to after your autopsy. The last part is the report. And this is, again, one of the most important parts of the autopsy, because you might be doing an autopsy in 2015, but your autopsy report is going to stay for the next 20, 30, and even more years. So, and the report is going to be held by not just dentists or forensic odontologists, forensic dentists. To go to the police, the lawyers, court, even layperson who has access to these reports. So a report is probably the most important part of your autopsy end of the day. So the report basically starts off with the case details. So it definitely needs to have the case number, the date when you're doing the autopsy, and then of course your qualifications so that the person reading the report knows that you're qualified to do this. Then the chronology of events. So who called you for the autopsy? Where was it done? What tools did you use? What was your step-by-step process while doing the autopsy? Then you need to put a summary of findings. So what were your findings, AM, PM? And of course, your conclusion saying, okay, my conclusion is that case number 001 is Mr. Mrs. this person. So that's the first 2 pages of your report. But the next few pages of your report is how you derive the conclusion. So it definitely needs to have your AM chart, your PM chart, your comparative analysis, a glossary, especially because, as I said, the report is going to go to people who are not as well. So they're not going to understand what mesial surface is, or they're not going to understand what mesio-occlusal surface is. So a glossary is important so that they know what they're looking at. After the glossary, you also need to put radiographs, the inference of the radiographs, and definitely photographs and their description. And that is your whole report, and that is where your dental autopsy ends. Now, we go to the research aspect of today's session, and this is going to be important not just for forensic odontologists, but also for general dentists or specialists, or even dental assistants, nurses, and dental students. So anyone who does dental charting, this part of the session is going to be important for. Now, forensic odontology, at least from identification perspective, depends on the concept that every individual has a unique dentition. And this could be anything. It could be dental features, it could be dental anomalies. So your dental features are going to be missing teeth, fillings, crowns, etc. Your dental anomalies are going to be rotated tooth, additional cusp, or spacing, crowding. So it could be anything that gives the dentition that uniqueness. But as I said, forensic odontology depends on this statement that every individual has a unique dentition. So my study, at least the aim of my study, was to evaluate the awareness regarding the forensic value of recording these dental anomalies. So I wanted to understand if other dentists understand how their dental charting has a role in forensics. So I basically conducted an online survey-based study on 101 dentists, and it had 4 sections. So the first section was based on the participant's background. The second section was a dental charting task, which we're going to be discussing in the next slide. The third section was questions on the attitude of charting these dental anomalies within these dentists. And section 4 was generalized questions in forensic odontology, their basic awareness in record maintenance, dental record maintenance as well. Now looking into section 2, so this was basically the dental charting task. So I basically gave them a photoshopped image that you can see on the screen with quite a few dental anomalies, as you can see. And I gave them 24 options for each tooth to select from. And I also gave an additional space for them to put in findings such as midline diastema, crowding, stains, calculus, attrition, findings of that sort. Now, after the dental charting task, to be honest, the results were quite disappointing, but expected. It was seen that a lot of obvious anomalies were overlooked, misnamed, and or incorrectly recorded. Obvious anomalies such as midline diastema and crowding were only recorded by the minority, and they're also misnamed accessory cusp and transposition was overlooked as well. But the third and the fourth section of the survey looked promising. We saw the majority of the participants understood that recording these dental anomalies had some sort of forensic significance and it was important. But from the dental charting task, it was seen that they never put it into practice. So this is one of the reasons why the dental charting task was included in the survey. Because if you ask a participant that, oh, do you chart all the anomalies that you see in a dental cavity? They're definitely going to say yes. But when you give them a dental charting task, you know how much they put those words into practice. It was also promising to see that they understood how forensic odontology worked, and record maintenance was important. And it was also good to see that 89 out of 101 participants maintained dental records as well. So the second portion of the survey was promising, but the first 2 sections were definitely alarming. Now, to understand the forensic value of dental anomalies, we're going to look into a particular case that I did in 2019. So this was a dental autopsy, a case that I did in 2019. It was a decayed body. The lower jaw had no teeth and the upper jaw had 4 teeth that you're seeing in the image. So we basically had to do a dental autopsy using 4 teeth. We had to identify a whole person using these 4 teeth in the image that you see. This is an image taken in 1995. Now, I would like you guys to focus on this distally rotated tooth for this premolar. And I'm going to say that it was this single rotated tooth, along with other factors in the x-rays, that helped in identifying this person. In this case alone, we can understand that every single feature, every single dental anomaly in the oral cavity can help in identifying someone in the future if and only if it is recorded properly in your AM data. The dental charts, your photographs, radiographs, anything, but as long as they are recorded properly in your AM data, even a single feature such as a rotation can be used for identifying someone in the future. Now, to look into this further, I created a scale of forensic significance of dental feature. The scale basically had 3 parameters, so that's incorrect, partially correct, and accurate. We're going to be taking 2.5 as an example from the dental charting task, which was discussed before. So 2.5 basically had an accessory cusp, and I got a lot of answers saying accessory cusp. Now, this is an accurate answer, and this is definitely going to help me with identifying someone. A partially correct answer would be a talons cusp or sound. Now, why is it partially correct? This is an inconsistency that I can explain in my dental autopsy report. So I can say this could be a possible dental charting error from the dentist. So talons cusp is an additional cusp. So maybe the dentist misnamed the dental anomaly. And even sound, maybe the dentist thought, okay, this does not require treatment. It's just an additional cusp. This still doesn't throw me off of the path of my autopsy process. But there were a few answers that said torodont, which is an incorrect answer. And this is definitely going to lead me to a wrong conclusion. Now, what is the forensic value or forensic significance of this? Now, accurate answers are going to have high forensic value because they're going to help me with a correct identification. Partially correct answers have moderate forensic significance. So as long as these errors are explainable, so as long as I can explain them in my autopsy report, they're still not going to throw me off of my autopsy process. I'm still going to get a right conclusion. But an incorrect finding or an incorrect charting from a dentist can definitely throw me off of my autopsy process, and it would lead to exclusion and a wrong conclusion. For example, I might have Mr. X in my autopsy table, and I would say, oh, this is not Mr. X based on another dentist's dental charting, all while it is Mr. X's family waiting outside of the mortuary, waiting to know if it's their father, son, husband, friend who is in my autopsy table. And this is one of the reasons why I believe, end of the day, although we think it's so inconspicuous, it's definitely a matter of life itself. And this is also one of the reasons why every single dental feature and anomaly has its own forensic value or forensic significance. Now, this is one of the reasons why I created the atlas. The atlas is called as the Atlas of. Now, because as I saw from our survey that a lot of dentists understood how it worked and they understood how anomalies can be used for identifying someone. However, their dental charting practices were quite. Now, the Atlas of Dental Anomalies was not created just for dentists. It can be used by dental students, dental nurses, hygienists, assistants, anyone who does dental charting. And it can also be used as a reference material for dentists, and also like a reminder for terminologies for the ones who have forgotten terms of certain dental anomalies that you don't come across often. So the atlas, so this is a PDF version of the atlas, which can be accessed using the QR code as well. But the digital atlas is, so if you go to www.theatlasofdentalanomalies.com, this is the page that you're going to come across. This is the digital atlas. So you can use the atlas either by clicking on the anomaly itself. So say, for example, Talon's cusp. So it'll give you a description and how the anomaly would look like. But if you want to read upon a particular anomaly, you can also go to the term as well. So say macrodontia, and it would do the same thing. I've also put positional anomalies because a lot of participants overlook positional anomalies. So I've also put midline diastema, crowding as well in the atlas. You can also look into root anomalies. So for example, chorodontism. So it'll give you like an idea about how a root anomaly might look like, but also pulp-related anomalies as well. So it will give you a radiographic image of the same. If you scroll down, this is the team. So that's myself, my supervisor, and we also had a medical artist in the team to create the atlas. And there's also a Let's Chat box where you can put in any queries in the future and be directed to me. You also have the PDF version from here as well. So if you click on it, it'll take you to the printable PDF version of the atlas as well. So that's the digital atlas. And that's how you use the digital atlas as well. Now, to conclude, we saw that identification by teeth is considered to be one of the easiest, reliable, and economical method of identification, but it is still not used up to its potential in several countries. We also saw that awareness on forensic odontology amongst dentists, at least in India, were exceptional, but again, their dental charting was poor as well. We also saw through the case study that every single feature anomaly can help in identification if they're recorded in your AM data, which is your dental records, photographs, radiographs, etc. We also saw the scale of forensic significance of dental features and the Atlas of Dental Anomalies. They were created so they can be they'll help in charting dental anomalies in the future, but also for the fact that it'll help in creating better, reliable, and up-to-date dental records, which can be used for forensics and identification purposes in the future. If you would like to read upon the whole research more, I've also published an article. That's my latest article, The Role of Charting Dental Anomalies in Human Identification. And that's me. Thank you for listening. And if you have any queries, any future queries, I'm more than happy to take it now.
All right, thank you so much for that amazing presentation, Dr. Jayakumar. Sorry, I'm Eva. Daniel was just filling in with me because I had some technical issues earlier, but we just go ahead and see the questions portion now. So some questions in the chat are, have you worked cases where the person had cosmetic enhancements? Did this affect your job?
So even if you have cosmetic enhancements, if it's a dental cosmetic enhancement, it's definitely going to be in your dental record. So as long as it's in your dental record, it's definitely going to help us more, and it's not going to like negatively or adversely affect my identification process. So as long as it's recorded, it doesn't really affect our work negatively.
Next question is, when a full body autopsy is needed, how do you coordinate with the pathologist?
So usually, at least in the mortuary that I worked in as a student, we had pathologists and odontologists working together. So usually they would coordinate. So either they would do their autopsy first, and then we get to do our dental autopsy, or we do the dental autopsy and then they would do. There wasn't any, oh, this is the way you do it. But most of the times we do dental autopsy when the person is not identifiable at all. So it's mostly decayed and there are no facial structures that you can visually identify someone from. So you usually, it differs from one mortuary to another.
So would you say your specialty is sort of like a last resort in sort of trying to solve these cases?
Not really, because we get a lot of dental not just identification cases, we have age estimation and bite marks as well. So it's not like last resort, but some cases, yeah, when you can't use pathology to identify someone, then it is forensic odontology. But in a lot of cases, there is routine odontology and pathology forensic processes to identify someone as well. Again, it differs from one institution to another.
And have you only worked with Scottish police or have you worked with other countries? Did this affect any of your procedures or is it pretty standardized?
I've only worked with the Scottish police because I've only been in Scotland after I graduated. But I think, again, in the standards, the regulations are different from one country to another, as far as I know. For example, I've not worked with the Indian police, but I've done sessions with the Indian police and even forensic studies there, some shadowing sessions in India as well. So from there, I understood that forensic odontology is not popular there. So forensic odontology over there in India is more like a last resort, like, okay, if A, B, and C doesn't work, then forensic odontology. But in a lot of developed nations that I know, especially in the UK, because forensic odontology is quite popular, there is a standard process for the UK. But again, it can differ from one country to another, and it can differ internationally as well.
Do you think you'll ever be moving to other nations to work and see how their process works?
I would love to. But of course, the COVID-19 pandemic has been letting me. But I would love to, yes. And especially for DVI purposes, disasters. So I'm working with an organization called Kenyan Emergency International Services. So what they basically do is if a disaster happens, they allocate forensic odontologists and forensic pathologists, forensic radiographers, a lot of forensic practitioners to that disaster to tackle the identification process. And that is one opportunity where you can actually go to other countries and identify a lot of victims, depending on how bad the disaster is and the number of victims, of course. But yeah, I would love to go abroad and see how forensic odontology differs from one nation to another.
I'm not sure if you know this, but would you happen to know if when you go to the different countries, like when you do those visits, would you need to update some sort of certificate or license or anything to be able to do that? Or is this or are you just with your certifications, you can kind of basically work in anywhere?
I think if I need to work as a consultant, if I'm moving to a country, then I might have to need for example, I did my dentistry in India, but if I need to practice dentistry in the UK or dentistry in the US, I still need to go through a certain process. And I think that's quite similar if you need to practice as a forensic odontologist. But if you're working in DVI processes, no, because you already join Kenyan or this particular organization using your qualification and your interviews. So you're sort of representing that company and going to a country like, say, Africa or India or Thailand. So then you don't need a certification because you're representing the organization. But at the same time, as I said, if you want to clinically work in a particular country, then I think there might be licensing and certifications that you need to go through.
Another question is, what are areas of research you find most interesting?
I think bite marks. Bite marks is very risky, but I really think bite marks are interesting. But I started with dental identification because this is more like my master's thesis. So that's what I continue in. But bite marks, as I said, it's got a tarnished image in the past because there's a lot of wrong convictions that were done, especially in the US. If you read upon the Innocence Project, this basically tackles a lot of cases that were that used bite marks, but not in a scientific manner to put people behind bars. So bite marks definitely needs a lot of research. But as I said, because of the risk factor, it involves a lot of forensic odontologists opt out of it. But I think bite marks is definitely a very interesting part when it comes to forensic odontology.
Are there any new tools or technologies that have sort of developed after leaving school that will help with the whole process of making things more accurate or anything?
Definitely, there are so many softwares coming with facial reconstruction, dental reconstruction, and there's a lot of technological advancement. There is 3D. So even with there's facial disfiguration when it comes to decay and decomposition, and even using skulls, you can sort of reconstruct your facial features to identify people as well. There are so many technical advancements in forensic ontology these days, even with bite marks. Back in the day, it was manual superimposition, but now there are so many softwares to sort of superimpose bite marks and someone's dental alignment to understand bite marks even better. So there are so many tools out there that has made forensic ontology way better than what it was 10 years ago.
How do you guys choose which like sort of softwares or tools you guys decide to implement? Because I assume these are like, really expensive sort of additions. So like which I guess procedures are like kind of most reliable? So you guys stick with like older techniques and you guys buy like which like I know you mentioned like the bite marks, like which I guess other sort of aspects of forensic ontology is sort of like less accurate. So you guys decided to like bring in more tools or like softwares that you mentioned?
So your dental identification part of it is very manual. It's just like how you do dentistry. So you basically just do manual autopsies. But when it comes to stuff like facial reconstruction or even bite mark superimposition, what software to use is a tricky question because there are so many softwares out there that you can use. But when I was a student, when we had our dent sessions on bite marks, I remember we had a tutor from Glasgow actually teaching us about a software. But again, as I said, I haven't worked on bite marks for a really long time. But choosing a software I think it's a very personal thing. There are so many softwares out there that you can use. But with facial reconstruction, something that I came across is there is something called as the SketchCop, which uses facial reconstruction, dental reconstruction, which is a really, I think it's a really cool tool for reconstructive purposes within forensics. That's definitely a really cool software to look into. And I think it does bite marks as well, but I'm not quite sure, but definitely reconstructive purposes. And as I said, choosing the software, and especially because it's expensive, it depends from, again, person to person.
And have you worked on court cases? What is that like?
I haven't had the opportunity to work on court cases, but during my forensic law module, we had to do a mock court. So we had to do it with law students. So we had a case, so it was an age estimation case, and we had to prepare our case studies and we had to work with the law student. So I was doing my master's in forensic ontology, and this student, I think, was doing master's in law, criminal law as well. And it was definitely like a court experience. So there would be a judge, we would go as an expert witness, and there are law students basically defending, and it's basically prosecution and defending. So no, I've not had the experience of doing a court case yet, but that was definitely a very interesting session because there is a particular way that you behave in court. There's a particular way you present your case. There are questions from both the sides. There are questions from the judge that can be asked. So there's a lot of etiquette when you go to court as well. So I haven't handled a case in court just yet, but I've had a very minor experience of how being an expert witness is like in court.
You think you're looking forward to it?
Oh, I am. It's just that the pandemic has actually caused a lot of disruption when it came to PhDs, online learnings, even court cases and stuff like that. So it's taken a toll on everyone's life, of course. So, but I'm definitely looking forward to it.
Does forensic dentistry overlap with other specialties like oral medicine? Does dentistry have specialties too?
So in India, from the university that I graduated from, forensic dentistry is under oral pathology. And I know a few friends of mine told me in their countries, forensic odontology was under oral medicine. And then I had someone who said it was under oral surgery. So I think it depends on the institution where they decide what it comes under. But I remember as an undergrad student, we did have a chapter on forensic odontology, but a very basic chapter on forensic odontology in oral path. So in a lot of institutions back home, it's still like a subspecialty in oral pathology. But at least in the UK, I know it's not a subspecialty anymore. It is just a specialty like prostopedo, other endodontics and stuff like that. So it depends again from country to country. I think it depends on the popularity as well. But I also know several countries are in the process of introducing forensic odontology as a specialty rather than a subspecialty as well.
How does your self-care look like since you work in such an intense field?
Probably something very personal to share. I've been diagnosed with generalized anxiety disorder during my dental school, and I've had some basic therapy, although I couldn't continue it. I did have therapy sessions, and mostly my self-care is distraction. So knowing how to disconnect your work and your personal life is a huge thing when it comes to forensics. And it's not just for dentists, for any forensic practitioner. For me, what personally works is distraction. And this could be anything ranging from reading, singing, watching something, dancing, and anything that actively distracts me from work is self-care for me. But again, it's a very personal journey. I also know people who are very mentally healthy within forensics, but it did have a toll on their personal life, and where they become quite numb to things and they get quite emotionless. But it is also because you handle death so much, it feels like nothing faces you anymore, nothing disgusts you anymore. But that's not the case. It's just knowing how to disconnect and connect with your work in a very healthy manner. So for me, self-care is active distraction, and that's it.
How does the salary look between a general dentist versus being the forensic odontologist?
Again, this is something that differs from nation to nation, but I should definitely tell you, because it's a research subject, you're definitely not going to make how you would make it as a clinical dentist, especially in your starting age. So I just graduated my master's, and I'm looking forward to a PhD, and I want to build my portfolio like that. So I'm definitely turning into research and being a clinical academician in the future. But I also know forensic dentists who are practicing dentists. So they have their specialty going on, like orthodontics, and they do forensic odontology consultations as well, if that makes sense. Yeah. So you can do that as well if money is something that your goal is. But in research, as I told you, there could be funding issues, especially with the pandemic. I'm personally dealing with my funding issues for my PhD. So money is definitely not on the higher ranks when you compare it to a general dentist or a specialist dentist. That is something you need to factor in before you get into a research subject.
And one last question before we wrap things up. If not forensic dentistry, what specialty would you have gone into?
I think oral surgery. I was definitely interested in oral surgery before I came across forensic dentistry as a student. I've always been very interested in oral and maxillofacial surgery. Probably because, again, it has a lot of incisions and sutures, and I don't know, it had a very surgical feel about it. And I don't know, I was really interested in oral and maxillofacial surgery. If not for forensic odontology, yes, that would be something that I'm specializing in.
All right, cool. Thank you so much, Dr. Jayakumar, and to everyone for tuning in for today's session. Just a reminder to take the quiz after this video, and thank you so much, everyone.